bringing together voices in child and youth healthcare. This is CAFC Presents.
CAFC would like to thank the following member organizations for their generous support of our knowledge translation activities: the IWK Health Centre, the Children's Health Foundation of London, McMaster Children's Hospital Foundation, the Children's Hospital of Eastern Ontario Research Institute, the Children's Hospital Foundation of Manitoba, the Montreal Children's Hospital Foundation, the Holland Bloorview Children's Rehabilitation Hospital Foundation, the Children's Hospital Foundation of Saskatchewan, and Trillium Health Partners. We would also like to thank the following Keystone and program partners for their ongoing contributions that support all of CAFC's programs and activities. If you have any questions or comments for our panelists, please type them into the question box at any time during the presentation. You can also share your thoughts and questions on Twitter by tagging @CAFCTweets and using the hashtag CAFCPresents. All of our webinars are recorded and can be found on the CAFC Knowledge Exchange Network. Use the CAN to share these recordings with your colleagues or register an account and post comments, links, or other resources that you think will be of interest. And be sure to sign up for the CAFC Presents weekly email newsletter to stay up to date with upcoming webinars and our recorded webinar archive.
All right, hello everyone, and welcome to today's episode of CAFC Presents. I'm Doug Maynard, the Associate Director at CAFC, the Canadian Association of Pediatric Health Centres, and it's great to welcome everyone back. We have our little hiatus over the summer, and we hope everyone had a great summer vacation and had a chance to take some time off. And now the kids are back in school, and it's time for the CAFC Presents webinars to start again, so it's great that everyone was able to join us. If you remember back to our last webinar back in, I think it was June, or early July, we heard from the folks, our friends at ChildBright, which is one of the SPORE initiatives funded by the Canadian Institutes for Health Research. That was our last webinar, and it's our pleasure to welcome a segment of the ChildBright team from the KT group within ChildBright to talk about one of their other initiatives within ChildBright, which this time is called BRAINstorm, which is ChildBright's Innovation Incubator event and grant competition for 2017. So without any further ado, it's my pleasure to introduce a few members from the KT team within ChildBright. We have back with us, as you might remember from the last webinar, Dr. Keiko Shikako-Thomas, who's one of the principal investigators with ChildBright. And Keiko is an occupational therapist at Montreal Children's Hospital and McGill University. And also joining us is Connie Putterman, who's a parent advocate for autism research and parent engagement inclusion, and is the co-organizer of the first Canada-Israel Autism Spectrum Disorders Research Symposium. And also joining our first two presenters is someone who's probably familiar with many who've listened to our webinars. Dr. Jonathan Weiss has done a number of webinars with us in the past focusing on autism typically. Dr. Weiss is an associate professor in the Department of Psychology at York University and is a clinical psychologist, and he also holds the federal chair in Autism Spectrum Disorders Treatment and Care Research. So it's my pleasure to hand the virtual podium, I think, over to Dr. Keiko Shikako-Thomas first. We'll hear from her first. Over to you, Keiko.
Hello, thank you, Doug. Hello, everyone. Pleasure to be here with all of you again. Today, as Doug mentioned, we're going to talk to you about a new initiative on the Knowledge Translation Program of ChildBright, the event that we're calling the BRAINstorm. And it's part of the Innovation Incubator series that we are creating within the Knowledge Translation Program. So the team, Doug already introduced to us. Next slide, please. Yes. Mm-hmm. So it's so myself, Connie, and Jonathan. We are the co-chairs of the Knowledge Translation Program on ChildBright, and Michelle is the Knowledge Translation Officer. So this program today is brought to you by the team. But and that's us. Before we start, we'd like to know who is out there. So, Zach, if you can bring the poll there. So, if you can just tell us quickly which group you identify with of the options on the poll, that so we can have a sense of who is in the audience.
All right, so we'll look at the results. Most of the people are researchers, 63% identifying as researchers, 21% as health professionals, 11% of the audience is persons with a disability or a parent or family member, and then 5% in the other category.
Okay, great. Good to know. Okay, so so the purpose of today's webinar is to learn about one of the concurrent sessions that is actually going to happen at the Brain Child Partners Conference in 2017. I'm going to tell you more about the conference later on, but essentially this conference is bringing together two networks of pediatric disability brain health research. So it's Child Bright, that is the sport that we are part of the program, and also Kids Brain Health Network. Those two groups are coming together for the annual meeting now in November. And the webinar today, we're going to talk about one of the concurrent sessions that are going to happen on November 6th. And the purpose is also to learn about innovation and knowledge translation. That's what the session is going to be about. And to ask you all in the audience to submit your questions and ideas before the event and how that can be done. So it's a lot of information session if you want, and we really would like to hear from you, from the audience, how we can get things done and about this new project that we are taking. So we'll talk about the conference. We'll talk about the Child Bright Knowledge Translation Program briefly, and discuss also what we call innovation in knowledge translation, and hopefully convince you all or tell you why you should participate in this event, how you can do that, and give you a bit of the details and logistics. And we'll have some time for questions and answers about the BRAINstorm event. So the Child Bright Network, for those who did not attend the webinar that Doug mentioned before the summer, it was really a CHR funded partnership between CHR and several pediatric hospitals, foundations, and other organizations. It's a 5-year program centered on patient-oriented research for children with brain-based disorders, really covering research across the lifespan on health services and optimizing brain development in general, and creating interventions and support systems for children and families with different types of disabilities. The network has different programs and services that are part of it. So as you see in the scheme, we have, of course, at the center is the patient-oriented research. So there are 12 different projects that are patient-oriented, that have stakeholders engaged and researchers working very close to stakeholders in developing those 12 research programs. We have a patient-oriented training component that you also have opportunities to learn more later on or at the conference. And Citizen Engagement Council, which is really composed of citizens, people, stakeholders, parents, and others who provide direction and guide, you know, the make sure that the network and the research program stay accountable to the patient-oriented mission. And the knowledge translation program, which is us, which essentially is doing two things. So finding better ways to, you know, share credible information, to share evidence-based information with different group of stakeholders, but mostly, most importantly, also creating research in knowledge translation and trying to understand how we can do this better and how we can learn from the process. So they're also within the network a data coordinating center and a health economics service, all things that are part of this big Child Bright program. So we really want to engage with different groups of people, parents, policymakers, everybody, all the different stakeholders involved in childhood disabilities as meaningful as possible in all these different aspects of the network. So to start talking about knowledge translation research and innovation, we would like to know from you how familiar you are with knowledge translation research. I know a lot of you are probably very familiar with knowledge translation, and you've heard of either through CAPC webinars or other opportunities, especially given the high percentage of researchers in the crowd. But about research, so we'd like to know how familiar you are with it. Not at all familiar, slightly, somewhat, moderately, extremely, just to have a sense of how many of you have been engaged with research in knowledge translation.
It looks like 26% said slightly familiar, 26% also said moderately, and 26% extremely familiar. Okay. And then the fourth place was somewhat familiar. So it's pretty much spread across the board, with the exception of not at all familiar, only 4% saying that.
Okay, that's interesting. Okay, good distribution. Thank you. Okay, so based on that, so we can have more time for questions at the Q&A period. But the way that the knowledge translation program is set up on ChildBright, it has really two different parts to it, right? The first part is the knowledge translation events, which is probably what most people who responded on the slightly familiar or somewhat familiar range, probably that's what people are most familiar with. It's the type of knowledge translation activities or events. So, for example, what requires to establish infrastructure and an evaluation framework for knowledge translation activities that happen within the network. That is webinars, KT cafes, which are going to start happening next year. But so webinars such as CAFC and webinars that we're going to use as a platform, or cafes, or more like traditional or common knowledge translation activities, writing policy briefs or summary of research results for the public. So that's the type of KT events and activities that we do on the knowledge translation program. But we also have a big part of it that is about knowledge translation science. So this is the research piece that less people, or a third more or less of the audience, is familiar with, which is really expanding on the science of integrated knowledge translation, which is how to engage people on all steps of the research process, people being parents, youth, policymakers, clinicians, different groups of people in the entire research process. So from setting the important research questions to develop the methods to respond to those questions, to helping in data collection, data analysis, and the outputs that will go to the public afterwards. So we really want to study the way we conduct patient-oriented research and how we can meaningfully engage with different stakeholder groups so as to produce hopefully more meaningful, more relevant, more applicable research output. So a part of the KT sciences that our team on the KT program is developing is really to develop better methods to engage stakeholders in the whole research process. We have a large committee of different stakeholders, parents, researchers in different fields, and youths participating in the KT committee. So that's how we are planning to develop different research projects on that. Why that's important? So traditionally, there's a lot of research that has been done on the end of grant knowledge translation. So that is at the end of a whole research project, you would think, okay, how do we get this message out? So traditionally would publish in scientific journals or present in scientific meetings. There's more in the last decade, perhaps, on trying to make an effort to bring it really to clinical practice. So presenting at clinical sites or making this relevant for clinical sites. But now we are evolving with the sport. We are evolving through integrated knowledge translation, where the goal is not only to communicate or raise awareness about research outputs, but also to engage with knowledge users as partners in a reciprocal relationship through the research process. So that's the concept that we're working, and that we usually take for granted that research results will reach their final users or that will be meaningful for them. But it is really important that we understand how to do that so that it is the case that at the end people are really feeling this is relevant and then can use that, and that can change child outcomes and quality of life for children with disabilities. So we're trying to really get engaged with different groups and study that through the process on ChildBright. So that's how the conference that we are talking about is not a normal conference, let's say. So it's not a regular type of conference. So the Brainchild Partners Conference, as I told you, is bringing together two networks. Over 3 days, there will be different events happening. For all the presentations and the more traditional keynote speakers or everything that is going to be happening at the conference is going to be oriented or centered on the patients or participants, stakeholders' needs. So we really have not only keynote speakers, but we'll have keynote listeners and people participating in the talks actively through those 3 days. And then, so on the first day in the morning, we have like talks about the Child Bright knowledge, the Child Bright research project, but with active participation from the audience and keynote listeners telling their input or their views on this research project. And then we'll have some workshops and events happening in the afternoon. We'll have a joint day on the second day, on the Tuesday, that is really about people doing how research in patient-oriented research is being done in the country and with international examples and trying to get a consensus on how we can do that better. And then on the third day, it's the Kids Brain Health Network conference, all following the same format. The date is there, so November 6 to 8, so do save the date, and we'll have the link for, the link for the conference is there. It's going to be in Toronto at the Westin Prince. You can have a registration for a full conference or a single day, and then Connie's going to tell you more about that later on. So the early bird registration ends on September 15. That's kind of the claim. So about the conference, I would like just to see from the audience who has already registered, who in the audience has registered for the conference itself. Or so if you have registered, that's really just for us to have a sense if people attending the webinar are the ones that are probably attending the conference or not. So if you have already registered or not yet, but you're planning to, or not yet, you still need more information to make your decision, or if you're not planning to attend at all, could you please respond to the poll?
And again, an even spread across, 30% saying yes, they've already registered, only 9% saying not yet, 30% saying they need more information, and only 30% saying they're not planning on attending.
Okay, good to know. Okay, that's important. Okay, good. So so hopefully we'll shed more light on about the conference for the 30% that needs more information. So here's information. The program is available online. But as I told you, on the first day, it's going to be in the morning. There'll be welcome remarks and talks about the different research projects on Child Bright, but with a special audience participation on the interacting with and how people can advance on that or participate on the different programs as well. In the afternoon, then we'll have concurrent sessions. One of them is on training, patient-oriented training in brain development disorders. There's a youth engagement workshop, and there is the Knowledge Translation Innovation Incubator, which is the BRAINstorm event we're talking here about. When you register online, you see that you should choose which concurrent session you're planning to attend, and our session, it's the Knowledge Translation Innovation Incubator. That's what it's called on the registration form, and this will be on the first day, so on Monday, November 6th, from 2:30 to 4. It would be important to indicate your attendance for those who are already, for the 30% who are already registered. If you have not indicated that this is the session you plan to attend, it's important because we'll send a follow-up form for your idea submission, which we're going to talk about in a minute. For parents, if you were there, you could have a parent agenda at a glance, and we'll talk about what sessions may be of interest in moving forward. Also, we will have events organized in all days by the Citizen Engagement Council that is made up of parents and different stakeholders to make sure that we do have an active participation of parents and families. And there are really, as I told you, all the event is going to be active on the stakeholder attendance participation. So it's not the traditional passive go and listen conference. Is really a hands-on conference, and we expect that from people to really participate and engage in. So I'd like to pass then to Connie Butterman, who is our parent co-lead on the Knowledge Translation Program, and she will tell you more specific details about the BRAINstorm event. Connie?
Thank you, Keiko. I'm really happy to be participating in this webinar, and I just want to say that as a co-chair and as a parent, and coming from a different perspective, we have planned this event and that we call BRAINstorm all together. So I've been very pleased and honored to be included in the planning of this session right from the beginning. So we're an example, I guess, in our committee of innovation in planning and knowledge translation. So I want to get right to what and who BRAINstorm is for. It's really about engagement, and we would like to see and have parents and patients, researchers, clinicians, and all other decision makers or people who are interested in innovation and knowledge translation there at this event. I think really our goal is to clarify definitions about knowledge translation and what innovation really means, to help determine who may have potential roles and what potential opportunities are there for each other. Really, we really wanted to, talk about the notion of KT and the real value of knowledge translation. So our appeal to you and our goal to you is to say, here's an opportunity to come to this event, to really be exposed to various stakeholders who are all interested in furthering innovation and knowledge translation, and again, an opportunity to meet stakeholders, including interested parents and patients. And I do want to appeal to the parents and patients who are on this webinar and to say that, it's really important that our goal, again, for this session is to encourage everybody to participate and encourage a place where people will get to know each other and find out and share ideas and express viewpoints and learn about ways that you as a patient and parent can have impact. And I think that our committee and ChildBright is really on the forefront by having this event to enable us to have a jumping off point, to have everybody in the room, including all people interested in children's brain health research, to be participating from the beginning. So we really think that at this event, there will be people meeting. We will be sparking innovation because everyone will be there together to foster and discuss and brainstorm on what innovation really could be. And I want to say something as well about the idea that as ChildBright and our KT committee is really leading this innovative approach to KT, and that we really think that the change will lead to an innovative and new ideas. So already there is change in thinking to include parents, include patients, include other stakeholders, without actually burdening the researchers or the ideas to find ways of partnering and of gaining trust and in gaining understanding. So we really encourage you to look at this event as a jumping off point for everybody. So we really hope to see you there. And again, as I said, innovation really is change, and we're already in the process of that. And we've already, and as a parent, have been included and participating from the beginning. So we really feel and see that that our BRAINstorm event will lead to more of that by introducing people to each other and sharing those ideas. What we really hope when we say action is we really want to see by the end of the session that there are people meeting each other and coming up with an innovative knowledge translation project. And I think this is another exciting part of our event, that we will be announcing a competition for an innovative project that we will be hosting, or that will be part of that BRAINstorm Day. So we encourage you to come and meet other people and bring together your innovative ideas. Next slide. So just to give you some event details before the workshop, and the first thing that we ask you to do is register. So those 30% who are undecided and those 30 who weren't planning to, maybe you'll change your mind and you will come out particularly to our session. So you need to pre-register for the event. There is an early bird registration, I believe, that closes on the 15th, and there is some special pricing for patients and families. So I encourage you as a parent, as a patient, to please consider this as a launching off point to the rest of the week. And I think there are a lot of very interesting other sessions for parents and patients, but this will get you thinking how to navigate the rest of the week if you've got some good ideas of where you might want to have your voice heard. Next slide. So I want to turn this over to Jonathan Weiss, who will be talking about the next few slides. Over to you, Jonathan.
Thanks, Connie. And thanks, Keiko, for the great introduction. I hope what people are taking from our description of BRAINstorm is that we really mean for this to be a workshop where it's action-oriented and it's full of engagement and exploration and really about idea generation. So let's talk a little bit more about the workshop. So during this workshop, we recognize that a lot of people are going to be coming with their own ideas of what KT means, of attempts and experiences they've had with employing KT before or using KT in some way, whether as a recipient of or engaged in the process of informing. And in speaking with our larger KT committee, it was clear that if we wanted to foster innovative KT, one of the things that we want to make sure that we can do in this workshop in BRAINstorm is to allow an opportunity for people, different stakeholder groups, including researchers and parents and patients, to discuss the problems where in the past that they've identified where some type of innovative KT may actually be helpful in bridging those kind of often complex, sometimes research to practice gaps or practice to policy gaps, or where could innovative KT practices beyond the standard kind of ones that Keiko mentioned in the introduction, like the lay summaries or the general end-of-grant activities, where could those kinds of innovative KT activities be part of the solution? We want to be able to share during the event the kind of strategies that you've employed or you've experienced before that you feel have worked, so that people, participants, registrants in the events leave with new ideas that other people have explored, but also through engagement, through the workshop, the hour and a half process, begin to develop new ideas, new KT ideas, things that they think are interesting and they'd like to try out, or they think other people should at the very least, but that together we believe when you bring the various stakeholders together with their own experiences and provide a structured venue where we can actually engage in a process of what we're calling fast idea generation. So there's actually going to be an activity that goes on where we, in the room, in situ, so to speak, engage in a process of generating new ideas together. Some of them will bear fruit, of course, some of them won't, but it's this process of idea generation that will be part of the workshop. So during this workshop, in addition to kind of just sharing, if you imagine a number of tables and people are sharing kind of ideas, we want to also provide an opportunity for new collaborations to potentially develop. Now, we're not going to be matchmakers, so to speak, in the workshop where we're going to force certain people together, but part of the activities will be about introducing yourself to people that you might not have come with or that you don't know. Find ways where you're sharing a particular interest in a potentially innovative KT project so that you leave the workshop with, if you imagine, the beginnings of potentially a KT team that involves a number of different stakeholders, some who, like I said, you've known before, and others who might be new to you. So we want to provide a venue where this idea of sharing information, of learning from each other, but also getting excited about potentially new ideas and who you could carry those ideas out with are some of the outcomes. Okay. All of this is because we want to help audience members prepare for an upcoming grant competition that we aim to enact after the workshop, after the conference. When we originally thought of this idea and proposed this idea of providing some funding for an innovative KT project, we wanted to do two things. The first is that we wanted to bring together a team or teams beyond the KT committee or the KT program as ChildBright. The point here is that we want to be, as Connie mentioned, hosts or a platform for others to shine with an innovative KT activity. That's you, the audience, the people who are participating in BRAINstorm. Originally, we thought, well, let's have all these teams already come into this workshop and pitch their ideas, and there will be some sharing and pitching of ideas, kind of novel, interested things you've tried before, as I've said, but we received feedback that at this stage, what people want to do is start with more of the learning, more of the introduction, use this hour and a half, we only have an hour and a half, to kickstart the process of this grant competition, rather than be the end product of a grant teamwork. So part of the BRAINstorm activity will be to start with that process, and then after the actual BRAINstorm, there will be a call that goes out to everybody who was there and beyond, essentially a call for potentially innovative KT projects. So how are we going to meet these kinds of goals? One is, I'll show you a link in a second, and a website in a second that we've already set up, is that many of you probably have already ideas of an innovative KT activity that might solve a particular challenge that you've observed. So we're going to provide a venue to collect these kinds of ideas even before the event occurs, and then post those and be able to share those with each other. Again, so I'll show you that link in a second. There will be a particular activity that our workshop facilitator will engage you in around generating these kind of rapid ideas. They might be kind of, novel ways, things that kind of push the boundaries on what we expect of KT, things that we might take for granted or that you're currently frustrated with, thinking outside the box, brainstorming, so to speak. So pun intended. We want to make sure that there's this opportunity to take the ideas that you're coming in with and letting those evolve, right? Taking these to be kind of plastic or malleable, so to speak, with the input of others, especially others who are different stakeholders and come from different perspectives, so that in the end we have a more effective or engaged KT activity, that you have one. And ultimately, some degree of making sure you sit with people you don't know, meet with people that are new, so that there's something like that you can also lead with. So we're not doing this alone, right? While you might imagine that we love to speak, given that we're taking up kind of this webinar time ourselves, Jerry Coe, who is the Director of Systems Innovation and Mars Solutions Lab at Mars in Toronto, will be our workshop facilitator, and he has tremendous expertise outside of neurodevelopmental disabilities or developmental disabilities, but in terms of thinking about KT innovation and beyond that, innovation more broadly. So he'll be able to speak to innovation, give examples outside of developmental disabilities of what innovation kind of looks like, and kind of lead us through this process of a rapid idea kind of generator. There will be different kind of activities where we'll also assemble and share with you at where you're sitting, different examples of what might be considered innovative KT within neurodevelopmental disorders research as well. So that will also provide some platform for evolving your kind of innovative ideas. So after the workshop happens and you've gone through and you've had this wonderful experience of thinking differently and pushing the boundaries, and you have somewhat of a kernel of a team, essentially, people that you'd like to work with to further develop an innovative KT idea, we'll launch this call where we're going to invite you and these new collaborators to submit a brief proposal for the grant competition. And this, we're going to try to make sure that this is not a laborious make work project, so to speak, but a brief proposal for what you can consider as a grant competition by December 1st. One of the important things about the KT activity that we want to support is that because this is all about engagement, the whole conference is about engagement, as Keiko said, it's not necessarily traditional, is that every team or every submission must have both a researcher as a representative, but also a particular stakeholder. And we hope more than that in terms of the breadth of individuals. We found, as Connie's mentioned, tremendous strength in making sure that our KT committee is diverse in terms of its perspectives, and even us as co-leads have some diversity in terms of our perspectives. And we'd like to see that also carry forward in terms of our KT activities or the KT projects and the ideas. Again, after we receive those grant competitions, people who are not associated with the KT committee and others who are not going to be associated with pitching an actual grant will review them and rank them, and one will be selected and funded. We'll feature this winning project, of course, and provide the funding to carry it out, or at least in part with other funding, depending on the scope of the actual project. As Keiko mentioned, the KT program is also about the science of KT, and we'd like to involve this innovative KT idea and study it as a case study to explore what the processes are like that the funded team is going through to actually enact that KT activity. So we want to study the experience as well as highlight the outcomes, of course, of that KT activity. To really understand how you get there, the challenges with the mechanisms that help to facilitate that process, and so on. So there will be a process of research along at the same time, concurrent with the KT activity development. So here are some to recap, some timelines or some deadlines that we've set. So we've hit the first of them today. You're well aware now of when the BRAINstorm workshop is going to occur. We've got the deadline to submit we'll announce that kind of proposal, and we've set a kind of a tentative deadline here of December 15th for the submission of the actual projects. After review and ranking and holidays and all of that, by February, we hope to announce the decision of the competition, and then there will be kind of from February to December, the development of and enactment of the innovative KT activity and the study of it as a case study, and then we'll be able to review the results after that. So, who is this for? I hope you're taking away that this is for researchers, but more broadly, this is for stakeholders, where researchers are one set of stakeholders in the process of integrated knowledge translation. So we hope that there will be knowledge that's shared among different perspectives. Who can attend? We hope that these broad stakeholder groups are going to attend BRAINstorm and together submit a project. And to recap in terms of what you need to do, we hope that you register for the conference and select the Knowledge Translation Innovative Incubator workshop to let us know that you'll be attending that and to receive the follow-up information about it. And while it says submit your bright ideas here, let me show you what it looks like. There will be a particular website. If I'm going to try to drag this over for everybody to see. So as you can see, so this is at the childbright.ca website. There's idea-submission-kt-innovation. So you can find this off of childbright.ca, the idea submission. If you already have ideas that you want to share and post, I don't want to give any examples of it to bias, but you'll see when you go to this, you'll be able to see already have an innovative project that you'd like to share. And then below, what you'll see here is a form that you can fill out right here that gives your name, email address, a bit about you, kind of ideas you have around a project title and a project, and then that you can submit to us. Okay, so this is at, again, idea submission, KT Innovation. This is not required to attend the workshop, the Brainstorm workshop, but this is that initial idea of getting us all kick-started on thinking in innovative ways. Okay, so with that, we're kind of nearing the end of our time, but we did want to make sure that there was some time for questions that the three of us could potentially answer for you. Again, keep in mind the brainstorm is going to happen on Monday, November 6th from 2:30 to 4 p.m. at the Westin Prince in Toronto. And with that, I want to thank you all for sticking with us for the webinar and open this up for questions.
Thank you very much for that presentation. Certainly it's great to see a lot of people already registered and considering registering for the conference, so I'm sure you'll have a great turnout there. So as Jonathan, Keiko, Connie said, if you have any questions about Brainstorm, about the conference coming up, about KT activities within ChildBright, this is your chance to ask some of those questions. We'll give everyone just a chance to sort of percolate on a question and get it typed into the box, and then we'll see what. So some people, you've certainly sold, apparently you've sold some people on the Incubator session. Dale is asking if you've already registered, can you change your selection to attend this session?
Yeah. Can you hear me? Is it everybody's mics open, Doug?
Yep, I can hear you.
Okay, good. So yes, you could. I don't think you can through the form, but on the form or on the confirmation, you probably received a confirmation email. You could use that to change your selection. So the information, the conference email, which I don't know from the top of my head now, but or you can email us or contact us to change the registration. I can send you the information. So I'm blanking on, and I can't access the internet right now to get the email, but you could, through the registration link or the confirmation that you received, there you can reply and ask to change the selection.
All right. Any other questions? We did have that link that Dr. Weiss was mentioning. We'll put that in the chat box for everyone if you do have to the submission page. If you do have ideas beforehand, I don't know. It'll also get you to the ChildBright website where you can find more information about ChildBright and about the conference.
Sorry, Doug, just to clarify something, like you don't have to be like a member of ChildBright or a researcher within ChildBright necessarily, or a stakeholder, a parent who is already involved with ChildBright to participate. So just a question that I had before about that. So anyone is welcome to join. Yeah, and the forms, the ideas, the form that that Jonathan put the link for, this is that there is a one of the boxes is asking permission if you want to share, like if you're okay to share within, we'll share within the Brainstorm hashtag and like social media and the idea is to have, if you put your idea out there, people who are also coming to the event may get interest and may want to meet you, during the workshop to further develop this idea or to work with you on developing this idea as part of the grant competition later on. So this is why we encourage people to submit their ideas beforehand. When we're gonna, in the form, you'll have space to see if you want to share it or not with the other attendees. But the idea is that if you can share beforehand, that will facilitate, encounters and collaborations during the actual event.
Right. We did have a question come in from Joanne, who's asking about, with respect to the grant competition, for those successful grants, what other than funding, what other resources might be made available to the successful sort of the grant recipient?
Okay, I can jump into it, sorry. Well, we'll have, as part of the knowledge translation program, so as Jonathan mentioned, we'll be doing a closed case study with the winning grant, of the winning project, sorry, to make sure that, so we'll be providing tools like assessment tools for stakeholder engagement from the beginning, for example. Will be the KT committee has a great set of expertise, both in all fronts, as Jonathan mentioned, for all different stakeholder groups that will be providing support through the KT committee expertise to improve areas or to develop further areas for the projects that will be being the grant recipient, and the way we want to feature, both the case study, so the group, how does the group develops the idea, what possible outcomes, all the assessment tools and resources in terms of following up will be available for the group.
All right. So that is the end of the questions. I mean, maybe there may be another question being typed in sort of as we speak. Yeah, that's great. We've got some contact information on the board, or ways to follow Child Bright on Facebook and Twitter. So that's very useful information. So while we're waiting to see if there's any last-minute questions, is there any sort of final comments you'd like to leave the audience with before we move on? Anything that we've forgotten? Keiko, we'll start with you, and then just give everyone a chance to sort of chime in if there's any final comments you'd like to leave the audience with before we sign off.
Well, no, I think this is it's great. I mean, the main objective was really to clarify and to make people aware of our first attempt to spark innovation in knowledge translation and patient stakeholder engagement in research. So this is it is an innovative event on itself. So the idea of bringing people together to create innovation together, that's what we hope to achieve with this. So we really encourage people to join us and complete the form, share your ideas. Through the website, you can send us an email. There's a contact information if you have other questions that you couldn't think of for now, but you would like to send us. So on the childbright.ca website, you can contact us to respond, if you have other questions, we'll be glad to answer.
All right, and Connie, any final words from you?
Yes, thank you, Doug. One of the things I just wanted to say to parents and patients and those that are still on the webinar, that I know as a parent that I want my perspective heard and understood and to be considered, but I do also realize that it's only one voice, and that what I really am hoping for is for this event that more parents come out and and if you have an interest in shaping or in having some say or in partnering in meeting researchers and to start to build relationships and to start to understand ways in which this kind of research can be done and the knowledge translated in innovative ways, then I urge you to come and not to be intimidated by the fact that it's something so new and seemingly foreign. It's not that foreign if you like people and you want to understand other people, so and how they work. And I think that parents and patients are coming from perhaps a different perspective, but we have the same goals, and the goals are somewhere in the middle, and that is to affect change and to help our children. So I really encourage you to and hope to see you there. That's all I have to say.
Well, those are great comments. I think very important, particularly for parents to hear how important their voice is to this type of work, but also how hard it is for some parents who may feel that there are barriers. They just feel uncomfortable. It's out of their comfort zone, sort of thing. But still understanding how important it is to have their voice included in this type of work. All right, Dr. Weiss, anything? We'll let you close it off. We don't have any other questions, so I think with any closing words from you, we'll wrap this session up.
Okay, well, first, thank you for the opportunity to have this webinar and to share these kind of ideas. I want to remind people, in terms of innovative KT, if you thought back 15, 20 years ago about what KT meant, KT at the time probably meant publishing your work in a journal or presenting it at an academic conference. And think about how far we've come already in this process of KT. So innovative KT is possible. It happens all the time, and when it does happen, it's amazing. So everybody here, you really have an opportunity to just continue that process, to do something really cutting edge and to think outside the box. So come to BRAINstorm. Consider, being a participant in and being involved in a team, and see whether this pushes the limit. Even if the ideas that you leave with are not what's funded, you still will leave with innovative KT ideas. So come and enjoy the process.
All right, that's a great way to end it, to come and enjoy the process. I think that's great. All right, well, thank you very much for coming and sharing this with us, and we do hope that everyone here is able to join you in Toronto in November. I know there will certainly be folks from CAFC there, so we're looking forward to it as well. So thanks again for the great presentation.
Thank you.
All right, we do our webinars every Wednesday at 11 a.m. and as I mentioned at the beginning, it's great to be back after our summer hiatus. And if you can't watch these webinars live, as always, we do continue to record them and make them available on the Knowledge Exchange Network. When you do get to participate live, it is your chance to ask questions and comments and that sort of thing. But again, if you can't make the live session, or if you want to share it with your colleagues, please just go to the Knowledge Exchange Network, where we post all of the recordings of all of our webinars. Next week on September 13th, we'll be learning about the pediatric Project ECHO, which is about empowering healthcare professionals to provide the right care in the right place at the right time. And we're going to hear from Dr. Adam McKillop, the project manager, and Annie Jawan, the education coordinator for the Pediatric Project ECHO at Sick Kids, which is a new model for medical education and healthcare delivery that expands access to pediatric care by connecting specialized interprofessional teams with community-based healthcare providers in order to share best practices in a collaborative network where all participants can learn from each other. So certainly of interest to those folks today who are interested in knowledge translation. I think it's a good tie-in there, so hopefully we'll see you there for that one next week. And following that, on September 20th, we'll be asking the question, is Canada cited sufficiently on the importance of grief in children and youth after the death of a loved one? And for that session, it's going to be our great pleasure to welcome back Sir Al Ainsley-Green, the former Children's Commissioner for England. And the focus of that session will be to identify whether healthcare providers are paying sufficient attention to how a death of a parent or a sibling or other major grief event impacts the surviving children. And joining Sir Al will be Alison Penny, who coordinates the United Kingdom's Childhood Bereavement Network, to share their experiences in addressing the needs of bereaved children. So that'll be a very interesting session coming up in 2 weeks. So some great stuff coming up in the next couple of weeks. It was great to welcome everyone back to our webinar series this September, and we hope to see everyone back here in the next few weeks. All right, bye everyone.